Let's bring in infectious disease specialist and ABC News medical contributor, Dr. Todd Ellerin, for more on all of this. Dr. Todd, good morning. So California amusement parks are set to open next month, but the state's Parks and Attractions Association is suggesting that roller coaster riders not scream. Now, one, how realistic is that? And two, will it really make a difference in limiting the spread of COVID?
Diane, so I can't figure out if you're more of the roller coaster or the teacups thrill seeker. But no, this is absurd. You can't have kids on a roller coaster and tell them they can't scream. I mean, I start screaming before the ride even starts. So, I think the good news is we're hearing that the density in the parks are going to be less. They're going to be outside. They're going to be masked. There'll be some distancing. So I'm good with the general principles. But of course, you can't keep kids from screaming. It's like going into a Freddy Krueger movie and saying you're not going to scream.
Yeah, I prefer the roller coaster to the teacups, but I need to scream to get that all out while we're doing all that. Now, case numbers are going up in 15 states. Do we know why? Is it variants? Is it loosening restrictions? A combination?
Yeah, I do think it's a combination of this. I think it's loosening restrictions. I think it's some of the pandemic fatigue we heard people talking about earlier in your segment. And the bottom line is, we're doing very well with vaccination, right? But still, only 2/3 of the elderly have received their first dose. That means 1/3 of them haven't received any doses. Most people in the United States still haven't been vaccinated. So I think we still have to be measured. We can't let our guard down too quickly.
And then as more people do get vaccinated, travel's starting to pick up. Europe is now considering a COVID passport for residents to travel throughout the bloc. What kind of an impact do you think COVID passports could have? And is this something we'll see catching on in other areas?
I do think so. Remember way back when, after natural infection, we were wondering if we were going to get serologic immunity passports. That didn't work because not enough of us were getting those positive antibodies. But after vaccination, we could show immunity passports. I think that makes sense, especially with global or domestic travel, while we're trying to really, ramp down this pandemic. But it has to be done equitably and ethically. What I mean by that is, let's say that you're in a state that's not allowing general population to be vaccinated, and you have a dying family member. We have to make exceptions. We have to have temporary immunity passports for people like that. Or if you're allergic to the first dose of the vaccine after a serious allergy, we have to allow people to travel like that. So there have to be exceptions.
Well, you anticipated my next question. What happens if you're not eligible yet and you have to travel? Are they talking about making exceptions like that?
They are. I mean, there are, absolutely. They're talking about exceptions to this, but we'll have to see how this digital immunity passport rolls out. It's going to be complicated.
All right. Dr. Ellerin, always great to have you. Thank you.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.